Hi everyone. Today I want to talk to you a bit about the Lyme infection and why it is so dangerous, the damage it does to your body, and why it's so hard to treat. I'd like to preface this by saying I am not a medical doctor. However, I have had this illness for over 20 years, only diagnosed for the past 6, but I have done so much research into it, and I think that has given me a pretty good understanding to be able to explain the basics to people. So I want to start back with the initial tick bite. When a tick that is infected with Lyme disease or other infections bites you, it injects bacteria into your bloodstream. In the case of Lyme disease, this is a bacteria called Borrelia. The Borrelia enters the bloodstream and starts going around your body. Now, if you're lucky and you realize you've had a tick bite, in America now, you can actually go to the doctor and you're given a course of antibiotics. When you take those antibiotics, it acts on the bacteria pretty much straight away, and the chance of it actually taking hold in your body is much less. Now, I got bitten in America, but that was around 20 years ago. So back then, you didn't get issued with the course of antibiotics. And in Australia, you still don't get issued with a course of antibiotics when you're bitten by a tick. So in my case, what happened was the bacteria that had been injected into me in the tick bite has been swirling around my body pretty much for 20 years. And it starts lodging itself into different organs in your body, and it starts multiplying as it goes through your system. Now, in a regular illness, your immune system would recognize that there's a foreign body in it, and it creates something called antibodies in your body to try and fight that infection off. In the case of Lyme, it becomes extremely complex. The Lyme bacteria is shaped a bit like a spring, and around the bacteria, it has something called a biofilm, and it's almost like a protective shield. And what that means is that the immune system may not recognize that the bacteria has entered your body and create the antibodies to fight it off. Or where it does recognize it and creates the antibodies, the biofilm means that the antibodies can't necessarily get to the bacteria to kill it off and fight against it. So the thing that the Lyme test is testing for is those antibodies. And this is where it gets even trickier. Firstly, the Lyme bacteria hides so deeply into your organs that sometimes, as I said, you don't produce the antibodies. So when the test happens, there is no antibodies because the Lyme bacteria has sort of evaded detection in your body. Then some of the tests that are used are not necessarily accurate. Some of the tests only have a 33% accuracy rate, which means the antibodies may be there, but the test may not actually pick them up. And that's certainly the case in a lot of the tests that we use here in Australia. Overseas, there are now some tests that are a bit more accurate, including one over in Germany, which is around 98% accurate because the test is a lot more sensitive, and if there's antibodies there, it's more likely to actually find them. I've been tested both in Australia and in Germany, and I've tested positive in both places for antibodies. And this is where it becomes yet again more complex, because in Australia, straight away, those tests are just ruled a false positive. They just say, I'm sorry, you have a positive result on your blood test, but it's not really positive, and they just say it's not there. If you ask doctors who specialise in treating Lyme and patients, they will tell you that a more accurate way to be diagnosing is, yes, to look at the test and accept a positive result, but also to accept the fact that false negatives can occur, and that we need to be looking at the patient's history, their symptoms, things like a bullseye rash, which go hand in hand with Lyme disease, and make a diagnosis based on all of that together. So if you're still with me, what happens as well is when the tick bites you, it very rarely only gives you one infection. So in my case, yes, I got the Lyme infection, but I also managed to score Bartonella, Babesia, and 6 strains of Rickettsia from the same tick bite. These then reactivated Epstein-Barr virus and Coxsackie B virus, which were laying dormant in my system, we think from when I was a child. I'm yet to meet any Lyme patient that only has the Lyme infection. Most of them have multiple other infections from that one tick bite. And of course that makes it even harder to treat, because you're not just treating one thing, you're trying to kill off all different ones, and they all respond differently to different medications. What also makes it tricky is that not all patients present the same. Because the bacteria is swirling through your system and lodging into different organs, not everyone gets the same symptoms, because the bacteria can land in all different places. In my case, it's in my autonomic nervous system, my brain, my heart, my bladder, and my legs. They're the worst places that I have symptoms in it. Somebody else might present with a totally different amount of symptoms. One that does seem to be the same for everyone is chronic fatigue, but the levels of severity also vary from person to person. This is a multi-system illness. It doesn't just stay in one place. And the symptoms can change from time to time, depending exactly where the bacteria is in your body at any moment in time. The bacteria is also very clever, and it can trigger a number of what's called comorbidities. These are other illnesses that the Lyme bacteria activates in your system. So for example, in my case, I have something called postural orthostatic tachycardia syndrome, which quite a few patients who are in the late stages of Lyme end up getting. That affects my heart rate and blood pressure and numerous other things. That is not specifically Lyme disease, it is a whole separate illness. But if I didn't have Lyme disease, I may not have got the POTS. So it can make you very sick, not just with the infections, but with other illnesses too. Now, I often get asked, why can't you just have a course of antibiotics and fix the infection? So in my case, I now have what's called late stage Lyme. It's been in my body for over 20 years, and under the Australian guidelines, the treatment for somebody who has been bitten in America, had a bullseye rash, and has tested positive to blood tests is a course of antibiotics, a very short course of antibiotics. Now, that's the same as the treatment that is given to somebody right after a tick bite. In my case, one course of antibiotics has done absolutely nothing for me, because my infection is way too serious for one course of antibiotics to fix it. Think about if a patient has stage 4 cancer. You're not just going to offer them one session of chemotherapy and then expect that to cure them. Yet that's what's happening in the guidelines for treatment in Australia. That's why I've decided to go to Cyprus to have treatment, because the treatment there is so much more elaborate. I'm going to be having treatment over a 6-week period, basically every day of the week, and I'm having multiple procedures a day. The main base of my treatment is something called ozone. And what happens with that is your blood is removed from your body and it is infused with the ozone. The ozone works at breaking down that shield that the Lyme bacteria has put around itself. Once that shield has been broken down, your immune system is then able to better generate the antibodies to fight it, and also it is better able to be attacked by any medication that you're given. Before the blood goes back in your body, it is also filtered, And then that process happens multiple times. As the ozone then travels through your body into all those different organs, it works on breaking down all those biofilms again and again and again, so that hopefully your body responds to the treatment. As well as that, I'm having numerous other treatments that work in similar ways. So the treatment is a lot more elaborate and a lot likely to have success. Of course, there is always the risk that not every bacteria in your body has been reached by the treatment, and that is why the treatment is not a cure. It is to help you on your journey to recovery, but they can't guarantee that it is 100% cure and going to make you 100% better. But as far as I'm concerned, it gives me a much better chance than having a short course of antibiotics back here in Australia that is basically not going to be able to help me at all, which is why I decided to go to Cyprus for treatment. So that's a bit of an overview of why these illnesses are so dangerous and so hard to treat. If you have any other questions, feel free to comment them below, and I'm happy to try and answer them in future videos.